So we are now going to go to Dr. Edwin Fisher and Samantha Luu. Could you all introduce yourself?
Sure. And Samantha, you want to start our slides? So my name is Ed Fisher, and I'm a clinical psychologist by training and a professor in the School of Public Health at University of North Carolina, Chapel Hill. And with me is Samantha Luu, who's the director of our peer support corps here at UNC Chapel Hill. And also with us in the group are two important colleagues, Patrick Tang, who's the program manager of our peer support project, and Hannah Barker, who's a very critical graduate research assistant who works with us. We're really glad to be here. I want to start by really complimenting again Natasha for that review. It was really terrific and so encompassing and comprehensive. And I was really struck by one point. You emphasized that this is all of us. It's not just 5% of the population or 9% of the population who have a diagnosable mental health problem at any time. You noted 56% of students are reporting anxiety and depression. And that's the exact percentage of a survey that was done here at University of North Carolina last summer. Got all of our attention and led us to recognize that we really need to be talking about, as you put it, this twin pandemic. So the importance of COVID getting to everybody is really important. A point that we've emphasized and that motivates a lot of the work we're about to describe is that COVID just gets under our skin. We may not realize it. We may just wonder why we're not sleeping well or why we're having more trouble getting our work done. And it's COVID, folks. It's COVID. It's COVID. It gets under our skin. It gets into our bones. And we need to just, as a culture, we need to cut ourselves some slack and recognize that we need to turn to each other, support each other, and get through this as best we can. So that's sort of the spirit of a lot of what we're doing at UNC. We have the UNC Peer Support Corps, which is promoting peer support on campus and is part of Peers for Progress, which is an ongoing program at UNC addressing chronic disease and including mental health problems around the world. And then with that, we have what's become the Carolina Peer Support Collaborative that I'll tell you a little bit more about in a minute. If I can have the next slide. So just a little bit about University of North Carolina. It's a big state university with students, staff, and faculty, a total of almost 43,000 people. COVID-19, of course, has been a big problem, but we've also had, in addition to the problems in general, we've had some major problems on campus with race and racism, and reckoning with that as a challenge for our campus. Additionally, we had a mental health task force before COVID that reported in 2019 and ended up recommending peer support as an important strategy for addressing mental health on campus. So with those several stressors and instigators, we've been doing a lot of work on peer support on campus. And next slide, I want to emphasize the variety of peer support that we're promoting on campus. For example, peer-to-peer is a program developed by undergraduates here. 11 peer responders are on their website, and people can go to the website and identify somebody that looks like somebody they'd like to talk with, and then they can, through the website, make an appointment and get some support from those trained peer responders. Next slide describes a very different approach in the School of Nursing with the leadership of their dean. they decided that they were going to get everybody in the school, students, faculty, staff, linked with each other through pods, small groups who share something in common, whether it's international students or other groups. And everybody in the school is in a pod and linked to somebody else, so that nobody is isolated. They don't have to meet in their pods 5 times a week and share their deepest secrets, but everybody has others that they can turn to. And that's, I think, an important sort of baseline objective for this kind of work. The next slide describes a different strategy. The School of Medicine, the medical students already had an advocates program that was pre-existing, but we've worked with them to enhance the peer support dimensions of the advocates' work. So in this case, we're not starting a new program. It's working with an existing program and helping put more peer support into that existing program. And finally, the next slide describes just the notion of peer support pods across campus. We've been encouraging people to just develop small mutual support groups, and it can be people who share a common interest. There's a cat lovers pod, there's a dog lovers pod, but also people who share more important, I guess, important concerns. There's an African American students pod, there's a moms pod of graduate students who are dealing with being in graduate school and having young children at the same time. And so a lot of places on campus are developing pods where people can connect to each other. The next slide, really, I want to talk about general strategies that are guiding this work. What we recognized is that in a lot of universities, there are single peer support programs. But if we're talking about reaching 43,000 people, one program isn't going to do it. It's not one size fits all. And we also realize that peer support is everywhere. Peer support is as old as human beings. So we're not reinventing a wheel here. So our strategy is to enhance and encourage peer support in varied formats through new programs, through existing programs. But our objective is to really get it so everybody, as at the bottom of the screen there, nobody is without someone to turn to. And apropos of Natasha's presentation, an important point is that this is not just for those with diagnosable mental health problems. This is for all of us, especially during COVID, as we are all having mental health concerns. And the concept is that if we really focus on promoting mutuality and promoting peer support for all of us, we'll end up creating an environment that meets the needs of each of us. So that's our general strategy and approach. The next slide is sort of repeating some of that. So it's not a single program or intervention, a wide variety of programs. We're looking to try to reach staff, students, and faculty. Importantly, I think it's implicit in what we've said, the ownership of programs is within the schools, departments, offices that house them. It's not our program. We're helping across campus people develop and enhance their own programs. And at the bottom of this slide is sort of our key accomplishment to date, which is the Carolina Peer Support Collaborative. From campus, we've been able to work with about 30 different schools, departments, offices, and other units on campus. And over 60 representatives of them come together a couple of times a month in the collaborative, and together they share ideas, share needs, identify concerns that need to be addressed, and together they really take the work of the peer support core and spread it across campus. We sort of think that the peer support core facilitates these programs and the collaborative connects them. And the next slide, I think, is my cue to turn it over to Samantha Luu, who is going to finish our presentation.
Thanks, Ed. So as Natasha presented those numbers, she mentioned how BIPOC communities have been disproportionately impacted by COVID and what that's meant for their mental health. And we've been thinking a lot about that in the context of our university. As Ed mentioned, the university is going through its own reckoning with its history of racism that's been institutionalized in the university. And so we think about this when we're thinking about health equity and how we can continue to address and promote it within our work. I'll acknowledge that peer support is a grassroots effort and historically has really disrupted different systems in which it's operated, including in healthcare. For our work specifically, we explicitly prioritize reaching marginalized groups on campus, students, faculty, and staff, but specifically those with identities who fall under BIPOC, perhaps LGBTQ, international folks, first generation, and others. The resources and trainings that we develop, we really try to address positionality in those resources and training and encourage people to think about what that means when they're providing peer support to another person. And in the collaborations that we pursue, we also try to advocate and push those groups to think, well, what does racism look like for you and how will you address that with the peer support program that you're thinking about developing? We have a lot of work to do. It's not anything we can solve in any kind of short-term timeline, but we think that as we move towards this culture of mutuality, thinking about trying to get people to support each other more, to rely on each other, to ask for help, to be a little bit more vulnerable and to be okay with not being so perfect all the time on their own. We are hoping that this begins to shift the culture away from this kind of individual, a little bit white supremacist academic culture that's been traditionally inherent in university culture. So visually, what we're doing is we want our outcomes to be that we want people to have someone else that they can turn to, that we're reaching students, staff, and faculty across campus. We're providing a social base for coping with challenges, including COVID-19 and addressing racism within our campus and to promote a culture of mutuality. And we're doing this by promoting varied peer support and mutual and informal support programs and activities within those groups, and as Ed mentioned, housed within individual departments and units. And we as a core group are providing consultation, program models and examples, assistance with training and implementation, as well as resources and materials for their programs. And all of that is pushed forward, as I mentioned, by the core, but also the peer support collaborative that Ed mentioned, which is that cross-campus group. And as he mentioned, we're facilitating this, the core, but the collaborative really is the group that connects across campus. It's a wonderful space for cross-learning, sharing, and really hearing from each other the different challenges that they're addressing and getting creative about the ways to address those challenges. So as I mentioned earlier, some of the resources and activities that we work on and provide include all of these different things. And our work to date has included starting those program examples that Ed mentioned and helping those programs promote and enhance what they're doing. We've put on multiple different trainings for different groups across campus. We've helped other groups develop trainings and put those on themselves for their own units. And then we've also pursued a lot of collaborations across campus. One of them that I want to highlight is our collaboration with University Communications. It has been really exciting for us to connect with communications in a way that I don't think that they typically have. In the beginning, the communications group was really focusing on, in the beginning of COVID-19 pandemic, the communications group was really focusing on physical distancing and making sure that people were staying healthy physically. But as we continued to work with them, we were able to really push them to also consider ways that they can promote healthy mental health for people across campus and how we can really reach everyone with all the work that we're doing. And last, I'm just going to wrap up by talking about what we're thinking about moving forward. We want the core to continue to promote the diverse uptake of models and to continue to facilitate the work of the collaborative, connecting across campus. As we've mentioned, COVID-19, we really saw people being very, very isolated, especially students. Staff were no longer having interactions with their faculty members. We weren't bumping into each other in the hallway anymore. So we wanted to continue promoting connections and making sure nobody feels that they're alone. I've mentioned the idea of culture of mutuality and encouraging people to reach out and support each other. And then COVID-19 has really revealed existing issues that have already been there in physical health as well as mental health, and the inequities in between, but they've also revealed how we can continue to address these problems in really creative ways. And we're hoping that in a post-COVID world, we want to continue pushing forward peer support and this idea of building community and reducing isolation amongst each other. And we're hoping that potentially some of the work that we're doing could be a model or helpful for other people in other organizations, communities, or institutions. So that's it for our presentation. And we're happy to take questions in a little while, but if you have any questions, please put them in the Q&A box.
Thank you so much, Dr. Fisher and Samantha. Very eye-opening and really nice to kind of see this in the context of like college and higher education, especially since that's what Paribo really works on. So thank you again. So I'm gonna just remind everyone that just joined, thank you so much for joining us. If you have any questions, please feel free to put them in the Q&A box or in the chat box. My colleague Colin is putting some resources in the chat as well.